welcome back to another video. I hope you all are doing well. Before I get started, I do want to say Happy Nurses Week to all the nurses out there. This is my very first Nurses Week as a nurse, so I'm really happy and excited. I love my job, so I'm very thankful to finally make it to this point to be able to celebrate Nurses Week. Alright, so today I'll be talking about basically the opposite of last week's video. Last week I talked about what it's like to admit a new patient into the NICU, and today I'll be talking about what it's like to discharge a patient from the NICU and what my role is as the NICU nurse. The first thing that I want to point out is that discharge planning begins as soon as the patient is admitted into the NICU. So you want to go ahead and think about what the patient's problem is, what kind of interventions we're going to have, and just when we think we may be able to discharge the patient. So as soon as the patient is admitted, you want to start discharge planning. On my unit, we have basically a checklist that we have to go through before a patient is discharged. So I'm just going to talk about a few of those things on that checklist. One of the first things on that checklist is the Hep B vaccine. So maybe about 2 days before the patient is discharged, the provider will put in an order for you to give a Hep B vaccine. So I just usually give the shot right in the patient's thigh. So that's one thing that we have to do. Another thing that we have to do is to give a critical congenital heart defect screen. So this is what a patient gets if they have not had an echo. If they've already had an echo, then they don't need this. But basically all you have to do is put the pulse ox on the patient's foot, which is where it should usually already be, and you check to see what the patient's oxygen saturation is. And then you move it to their right hand, and you want to compare the oxygen saturation from the right hand to the foot. So if there is a split, like if it's usually greater than 3, so let's say the oxygen saturation is 90 on their right foot, but it's 98 on the right hand, then they don't pass. You want to have those oxygen saturations to be very similar. So if it's like 98 on the right hand and 97 on the foot, then they pass, and that's great. Before the patient goes home, they will also have a hearing test done, and this is done by the audiologist. They come up and do everything for us, and then they will just let you know whether or not the patient passes. Another thing on the list is the car seat test. So not all patients in the NICU get this done. It's mostly for patients who have been on some type of respiratory support, so if they've been on nasal cannula, bubble CPAP, or intubated, they will get a car seat test. So for the car seat test, as a nurse, it's my job to have the parents bring in the car seat that they are planning on taking their baby home in. And you have to use that car seat. You can't just use any car seat. It has to be the one that the parents are going to take their baby home in. And so I had to check to make sure that it is not expired. And yes, car seats do expire. I didn't know this until I became a nurse. So I checked the expiration date, and I also checked the minimum weight on it. So it has to be similar to the patient's weight. So if the patient is only 4 pounds, then they cannot use a car seat that is 5 pounds and up. Next, I make sure I put the baby in the car seat, and I have to properly strap them in. So car seats are confusing. They even had us take a whole class to learn how to properly put babies in car seats, so I learned a lot from that. So I properly put the baby in the car seat, and then the car seat test is 90 minutes. A lot of our patients live very far away from the hospital, so we have to make sure that the baby is able to do well in a long car ride in the car seat. So basically the car seat test is just making sure that the baby can keep their oxygen saturations up. So if the baby desats several times and they're not able to pull themselves up quickly, usually like within 10 seconds, then they fail the car seat test. But if they do fine during the entire 90 minutes and they're not desatting, then they pass. Next on our checklist is NICU knowledge. Now this is something that we do for the parents. We actually have iPads that parents can watch, and it has all these videos on there that cover very important things like SIDS, shaken baby syndrome, how to properly take your baby's temperature, when to bring the baby into the hospital if they feel like something is wrong. So it's just educational videos for parents to watch, and then after the parents watch it, as a nurse, we just ask them if they have any questions and do some kind of reinforcement for them. Now some patients do have to go home on special equipment. Like we have patients who may go home with a trach or even on a feeding tube. So for these patients, we want to make sure that we educate the parents on how to properly handle this equipment and do everything for their baby. So if a parent is supposed to go home with their baby, let's say tomorrow, and they're feeling a little uncomfortable, they're not sure if they're doing things right, then we're not going to force them to go home on that day. We want to make sure that the parents are confident and comfortable with caring for their baby when they get home. So we'll just give them a few more days to practice and do a little bit more education for them. And one of the ways that we do this is by allowing parents to room in. So we have rooms on our unit where parents can stay overnight with their baby. So we take the baby into the room with the parents and they sleep overnight. But even though the baby is in a different room, we do still monitor the patients. We can see their heart rate and everything just to make sure that they're okay. So this just helps parents get a little bit of practice in before they actually take their baby home. And if they need any help during the middle of the night, we are there to help them out. So let's say it's finally the day of discharge. The baby finally gets to go home. So let's talk about what we have to do as the nurse. As a nurse, it is my job to gather all of the patient's belongings. So I will gather all of their extra diapers, blankets, clothes, anything that belongs to the patient. Even if the mom is breastfeeding, I will go into the milk room and I will grab all of her milk that she has pumped and put it on some ice for her so she can take it home. So I just gather everything and put it in some bags. I also had to print out a summary about the patient, so it basically just has all the safety information on it, very similar to the NICU knowledge videos that the parents watch. It has information about the patient's next appointment, the date and time for that. It has information about any meds that the patient may be going home on, so I just print this out and make sure I give it to parents. Another thing that is optional is a discharge blessing. So we can have a chaplain come in and say a prayer for the parents and the baby before they go home. This is completely optional, but any nurses or anyone who has helped take care of the patient can go to the blessing and just say their goodbyes and be a part of the prayer. So some parents do like to do that. Once that's over, then I will have the parent put their baby into the car seat. As a nurse, I cannot put the baby in the car seat myself because of liability issues. So if I put the baby in the car seat, whether I do it correctly or incorrectly, and the patient gets into a car accident on the way home, then I could be liable for that as a nurse since I put the baby in the car seat. So you want to have the parent put their baby in the car seat themselves. And this is a great opportunity for parents to ask questions because, like I said before, car seats are confusing, and if this is a parent's first baby, they may not know exactly how to safely put their baby in the car seat. So you have the parents put the baby in the car seat, make sure that they're in there correctly, and then you just want to maybe notify the doctor and let them know that they're about to go, just in case the doctor has anything they want to say to parents first. And then they are good to go. So they can just go ahead and take their baby to the car. And if they need help, let's say they have a bunch of things to carry, you as a nurse can help them take their things downstairs to the car. And so once the baby is gone, they're discharged, it's a happy moment. Your next job is to basically do your final charting on your patient. And then you want to take, as I was saying, you want to do your final charting on your patient, and then you take the patient's chart to the secretary, and then you go back to the bed spot and you just want to put up everything, clean up everything as good as you can, and then housekeeping will come and do a thorough cleaning of the bed spot so that it's ready for the next patient. That is pretty much it. That's a general overview of what happens when it's time to discharge a patient and what my job is as a NICU nurse. I used to be really nervous and try to avoid discharges because I just didn't know what to do and I just didn't want to do anything wrong. But now I see that they're really not that bad. They're pretty simple and easy. And of course, the more you practice with it, the more comfortable you'll be with it. So that is pretty much it for today's video. I hope you found it helpful and I hope you all have a lovely day. Bye.